It is my privilege to share with you today about dewormers, dewormer resistance, and an introduction to FAMACHA I-scores. We're going to talk about proper drug usage. Drugs must be labeled for use and the species in which they are used. This applies to both over-the-counter and prescription drugs. Off-the-label use is the exclusive domain of licensed veterinarians who must address the questions of dose, route of administration, duration of action, and withdrawal time. Food and Drug Administration regulations require a valid client-patient relationship. The vet has been to your farm and knows your animals for off-the-label use of drugs such as dewormers. Violations are the liability of the producer. All members of a dewormer action family share the same mode of action despite there being several members of the same family. If a drug in that group is not effective, other drugs in that family may not be either. The first family is the benzimidazoles. All members of the family kill roundworms, eggs, lungworms, and tapeworms. This family includes fenbendazole, sold under the trade names Pasture and Safeguard, oxfenbendazole, sold as Synanthic, albendazole, sold as Valbazin. Valbazin is the most potent member of this family and also kills flukes. In general, this family has the greatest level of dewormer resistance because of the long history of use, especially Pasture and Safeguard. The next family is the group of cell depolarizers. Levamisole, which is sold as Tramadol, Levamisole, or Prohibit. We also have another member of the family called Morantel or Parentel tartrate, sold as Rheumatel or positive pellet dewormer. These dewormers are basically only effective against active roundworms, i.e., they do not get arrested L4 worms. An overdose can be toxic. You need to know what the goats weigh to use safely. The last family is the ivermectin milbemycin group. This includes Ivomec, the original member of the group, other members Dormectrin, sold as Dectomax, Eprenomectin, sold as Eprenex, and Moxidectin, sold as Cydectin. Cydectin has a long residual effect. All members of this family are effective against roundworms, arrested roundworms, lungworms, and sucking lice. Few dewormers are approved for use in goats. Only fenbendazole, sold as Pasture Safeguard, Morantel, sold as Rheumatel or positive pellet goat dewormer. In general, we use 1.5 to 2 times the sheep or cattle dose per pound of body weight because goats have a faster rate of passage and relatively larger livers to detoxify the dewormers. At the last slide, there is an American Consortium for Small Ruminant Parasite Control. They do have a dewormer dose list that is very good for goats. Administer dewormers back behind the tongue so that they go to the rumen. Combinations of dewormers can be effective when there is dewormer resistance. We can use Valbazin, Prohibit, or Cydectin. Use 2 of the 3. I should point out that we can use a poorly effective dewormer and a moderately effective dewormer and have a highly effective combination. There's no science to the choice of dewormer combinations. Use a full goat dose of each drug at the same time. It's important to use selective dewormer because you can develop a high level of resistance very quickly to both dewormers in the combination. Observe the withdrawal period before selling animals. In general, pour-ons work poorly in goats. Dewormers should not be injected because they promote dewormer resistance. when you try to feed a dewormer as blocks or in the feed, there are problems with each animal getting the appropriate dose. Deworming in water can work, however, the problem is suckling goats don't drink much. We're going to shift gears and talk about deworming strategies, listed here. In salvage, that's when you deworm an animal just to save their life, and that's your criteria for deworming, is when animals get down. The bad thing about this approach is severe production loss has already occurred by this time, and goats are more subject to other diseases, as well as other goats will need dewormed also besides this one. Strategic deworming is deworming at strategic times of the year when worms are most likely to be a problem, such as pre-kidding or pre-lambing and weaning the lamb or kid at weaning. Yes, deworming at pre-kidding or pre-lambing can be a highly effective method of controlling worms because animals are very susceptible to worms when lactating. However, strategic times of the year worming strategy neglects differences in the weather. Opportunistic is when we're working with the goats and therefore it's convenient to deworm them. The effectiveness depends on when that time happens to fall that they get dewormed. The goats may need dewormed badly when we're not working them, or they may not need to be dewormed when we do work and deworm them. Tactical deworming is deworming when weather conditions are favorable for transmission of parasites. Australia had a scenario of deworming animals 2 weeks after 2 inches of rain in a month's time and a month average temperature greater than 60 degrees. However, it's best to use FAMACHA or fecal egg counts. Scheduled deworming is deworming at regular intervals, such as every 30 days. It's expensive, can be very effective in the short term, but it promotes a much faster development of dewormer resistance. Selective deworming is deworming individual animals only when they need it, using FAMACHA or fecal egg counts. It reduces the rate of development of dewormer resistance. It helps to identify resistant individual animals and reduces the overall need for dewormer and the cost of the dewormer. One may deworm with fecal egg counts. Need to take fecal egg counts every 2 to 4 weeks depending on time of the year. Mark certain animals and take fecal samples from them each time. Number of animals would be a minimum of 4 animals or the square root of the herd, such as 10 in a herd of 100. Be sure the animals represent a cross-section of the herd as to age, sex, and class. May be a good idea to sample half or all of the bucks so that you can assess their parasite resistance. Since the bucks contribute half the genes to the herd, this is particularly important. Take grab fecal samples and do fecal egg counts such as by the master procedure. Individual animal counts are best, but some have used composite samples for the herd. That is, taking fecal samples from all of your animals and putting them into one sample. What level of fecal egg counts do we need to deworm at? During Haemococcus or barber pole season, or we could say baseball season, since baseball season it's warm enough for barber pole worms, we deworm all dry adults at 2,000 eggs per gram, 1,000 eggs per gram for all other classes of goat, except for the dairy does, and we need to deworm those at 800 eggs per gram. At other times of the year when Haemococcus is not the dominant worm, we lower those thresholds to 1,000 eggs per gram for dry animals and 500 eggs per gram for all others. The disadvantage of this approach is that it takes 3 weeks from your goat ingesting a larva until the larva is producing eggs, and the larva during those 3 weeks is sucking blood all of the time. But in general, infection is a gradual process, and this is not an important consideration. Do you give your goats a shot of LA-200 in February because they had pneumonia last February? No, you watch out for it and you wait for the goat and treat them when they show symptoms. We haven't had the knowledge of how to determine when animals need dewormed. Yes, we knew that with a barber pole worm they would get pale, but how pale do they get before they need dewormed? We did not know the consequences of excessive deworming, which is the rapid development of dewormer resistance. Dewormer resistance is the biggest threat to the small ruminant industry. This means we will have to rely on techniques other than dewormers to control worms, such as animal selection, pasture rotation, and co-species grazing. What is dewormer resistance? An effective dewormer will reduce fecal egg counts by 95% 7 to 14 days after giving the dewormer. If we have dewormer resistance, we're going to see a lower percent reduction in fecal egg counts. For example, if we have a fecal egg count before deworming of 1,000 eggs per gram, and 10 days after deworming we take another fecal sample that has 200 eggs per gram, that means we have gotten rid of 80% of the fecal eggs, and we call it a fecal egg count reduction of 80%. Although this fecal egg count indicates that we have dewormer resistance, the dewormer is probably still working sufficiently for us to use until it gets down around 55%. To do a fecal egg count reduction, you need several animals. One individual animal may even be misleading, but you need 5 to 6 goats minimum. You deworm them, take initial fecal samples, then we take post-treatment samples at least 7 to up to 14 days after deworming. We compare post-treatment with pre-treatment fecal egg counts. We calculate the fecal egg count reduction, which is the percent of eggs at the first sample that disappeared at the second sample. We have the fecal egg count reduction here on a study conducted by Langston at 9 different farms in Oklahoma 20 years ago. If we look under the column for ivermectin, we'll note that we have ivermectin resistance on most farms, and some very severely. If we look at the second column on valbocin, it's working pretty good on several farms, and then it's working very poorly on some farms. This is why it's not good to get a recommendation from someone else on what dewormer's working on their farm, because their farm may be quite different from yours. The next column is levamisole or prohibit, and we'll note that at this time it was highly effective on all farms. However, this has changed since this time due to the use of levamisole. Under the column for cydectin, we see it worked very good. This was probably the first cydectin used in Oklahoma. And no doubt cydectin at all farms would be much, much lower than this. How do we prevent dewormer resistance? First step is use the correct dose of dewormer. If we underdose with dewormer, that promotes dewormer resistance. In the past, it's been thought that rotating dewormers would prevent dewormer resistance. However, it's been found by doing research that rotation of dewormers tends to develop resistance to all dewormers in the rotation. In general, you need to stay with the dewormer for at least a year. You must verify that a dewormer is working by doing a fecal egg count reduction test. If you're deworming more than 2 to 3 times a year, you're building dewormer resistance. The biggest factor is to use other management practices to reduce the need for deworming, as discussed in the previous talk. Even though you may prevent the development of resistance on your farm, you may buy in resistant worms with that nice buck that you brought in. Therefore, all new additions should be quarantined and aggressively dewormed upon arrival. Deworm with 3 dewormers from different drug classes, full dose, at the same time. The animals should be maintained in quarantine for 10 to 14 days, and you should perform another fecal egg count to confirm that no eggs are shed. How do we get dewormer resistance? This is an oversimplification. In our animal here, we have a mixture of susceptible and resistant worms. If we treat them with a dewormer that they're susceptible to, only the resistant worms survive for the next generation. However, these resistant worms can mate with what we call refugia. These are worms, actually worm eggs and larvae on pasture, and worm eggs and larvae being produced by animals that did not get dewormed. Not all worms on a farm are resistant to dewormers. Killing some worms may relieve disease symptoms. Removing 50% of the worms will result in clinical improvement, and it appears that the treatment was effective. However, animals will require treatment again very soon. Eventually, most worms will become resistant, and when treatment fails, animals will die, farmers will go out of business. Refugia is a proportion of population that is not selected by dewormer treatment. They're in refuge from the dewormer. This includes worms and untreated animals and their subsequent larvae, as we discussed previously, eggs and larvae on the pasture before treatment. This provides a pool of genes that are sensitive to the dewormer for the resistant worms that survive deworming animals to mate with, diluting their dewormer resistance genes. Until recently, it was overlooked as the most important component of drug resistance selection. The concept behind selective treatment is based on parasites, like wealth, not being equally distributed to all individuals. The resistance of animals to parasite differs. 20 to 30% of the animals will harbor 80% of the worms. These animals are responsible for most of the egg output and pasture contamination. Getting rid of these animals will help you tremendously in your parasite control program. If we look at the fecal egg counts across your herd, and we were to graph them here on a graph that goes from 0 to 20,000 eggs per gram, we'll notice that some individuals have very high fecal egg counts, many do not have high. In this case, 33% of the goats have 80% of the eggs. The top 6 animals, 6 of 36, are producing 50% of the eggs. Therefore, if we deworm the top third of the animals, those with fecal egg counts over about 2,000, this is going to give us adequate control, as those to the left of the line have low enough fecal egg counts that parasites are not bothering them. So if we deworm those to the right of the line, and here's a graph that goes from 0 to 2,000 eggs per gram. So we have not dewormed the animals on the left, but we've amplified the height of the bars. However, on the right, we see the animals that we did deworm. They have low levels of fecal egg output. However, all of these eggs will be 100% resistant because that's the only worms that survive deworming. The animals on the left will produce eggs that have a low level of resistance for the eggs on the right to mate with when they grow into larvae. They're diluting their fecal egg count, diluting their resistance. How do we achieve selective treatment? The FAMACHA system is a novel technique for the assessment of barber pole worm and the need for treatment. It was developed in response to the severe dewormer resistance in South Africa. It is a method method of selective deworming, which leads to a large reduction in the number of deworming treatments given. Most importantly, it significantly decreases the rate of development of dewormer resistance. In fact, there are several research studies that shows that it halted or actually reduced the dewormer resistance by a small amount. Since the primary impact of the barber pole worm is anemia, one can indirectly measure parasite burden and the need for treatment by measuring anemia. This is only useful where the barber pole worm is the primary parasite species. This is the FAMACHA card. You can see on the card is a picture of a sheep's eye with an arrow pointing to the area of the eye that you're looking at and matching that color to one of the 5 color chips below. The dark red color indicates a healthy animal. Goats are seldom red like this. FAMACHA score of 2 is red to pink is acceptable. The animals are not anemic. FAMACHA score of 3, which is pink, they're borderline, suspected anemia. They may require treatment, and we'll discuss more about that later. If we've got a FAMACHA score of 4, pink to white, anemia may require treatment. Well, they will require treatment. And then if we've got a FAMACHA score of 5, which is white, those are severely anemic and will die without special treatment in addition to the dewormer. To look at the eye, we used a technique called cover, push, pull, pop. Cover the eye by the eyelid, push down on the eyeball, pull down on the lower eyelid, and the mucous membrane pops out for you to match it to the color of the card. This slide demonstrates the technique. You can see the thumb over the eye, pushing down on the eye. You see the other thumb below the lower eyelid, pulling down, and that lower eyelid popping out so that the color on the card may be matched to the eye mucous membrane color. The disadvantage of FAMACHA is that it only identifies animals that are infected with the barber pole worm. There are other, especially temperate species worms, that causes problems in the U.S. And so we need some other techniques that will help us also to identify those worms and the real need for an animal to be dewormed. Of course, we call this a 5-point check. We're going to, of course, look at FAMACHA. We're going to look and check for bottle jaw. And if an animal has bottle jaw, they get dewormed regardless of other body conditions. Body condition is an important parameter. Some work in Australia shows body condition is nearly as good as FAMACHA for selective deworming. We're going to look for diarrhea because especially your temperate species worms cause diarrhea in an animal. And then we're going to check to see if that animal has a shiny hair coat. So we're going to evaluate all of these criteria to determine whether the goat needs to be dewormed. For the FAMACHA score, if there's any doubt, you can check the other eye. There's no half scores. Use a higher number score if you're unsure. If it's between a 2 and a 3, score it a 3, the more pale color. Do not hold the eye open for more than a few seconds. The color will change. You can retry on the other eye. Keep records. Record the identification of dewormed animals so those requiring the most deworming can win an all-expense-paid trip to the auction. On large farms, animals can be tagged in a variety of ways. In general, treat goats and sheep in categories 4 and 5 with an effective dewormer. You must know what drugs are effective on your farm, or this may result in the death of your goat. Hence the importance for doing a fecal egg count reduction test on your own farm. If in doubt, score at the more pale category. Do not use in isolation. Use fecal egg counts, rotational grazing, strategic or tactical treatment. Should point out that strategic treatment around the time of kidding can be very important because lactating animals are very susceptible to parasites. The Australians have worked out techniques where they, to provide refugia, they only deworm animals that are carrying twins, leave those carrying singles not dewormed, and they deworm all of their first time kidding animals. So then the single bearing ewes that are those that are left for our refugia. If when we do the FAMACHA on our herd, there are none in 4s and 5s, they're safe. We need to check 2 weeks later if the weather is warm. When it's warm, it's FAMACHA season. If it's baseball season, it's FAMACHA season. And dry or cool times of the year, check every 4 to 6 weeks because we have those temperate species worms that can cause us problems. If they're less than 10% in categories 4 and 5, then we're safe. We treat those in 4s and 5s and check the whole herd in 2 weeks. If greater than 10% of the flock or herd are in categories 4 and 5, consider treating the 3s, especially in pregnant, lactating, young, and thin animals. Rotate pastures if possible. Do not deworm all animals before changing pastures. This can promote the development of dewormer resistance. Examine especially the stragglers, that's animals lagging behind the flock or herd. Check for animals with bottle jaw and treat them regardless of whether they're anemic or not. This is an indicator of the brown stomach worm or other worms that will not cause anemia. Identify animals that need treatment the most often. These are the ones contaminating the pasture for others in the herd or flock. Cull animals that require the greatest number of treatments along with their offspring. Caution, compare does with twins to other does with twins. Because a doe with single has less nutrient requirement for raising her single than the one with twins, and so the one with twins is at a disadvantage. This will improve the genetics of resistance of the herd or flock and will significantly cut down on the need for dewormer in subsequent years. Caution, the paleness or reddening of the eye may have other causes than the barber pole worm. Other causes of anemia include other parasites such as coccidia, liver flukes, lice, and external parasites. Nutritional deficiencies, especially copper and cobalt, which are necessary for making red blood cells. Other diseases, such as anaplasmosis, can cause anemia. Other causes of redness include environmental conditions such as dust or allergies, diseases such as pink eye. Caution, lambs, kids, pregnant or lactating ewes or does need special attention. Always score animals with the help of the card, not from memory. Replace the card after 24 months of use since they fade just like stop signs that are facing south fade. FAMACHA is not your total worm control program. It is a tool. You need to maintain other standard worm control measures such as monitoring of fecal egg counts, rotational grazing, resting your pastures 6 or more weeks, alternation of goat grazing with cattle or horses. The cattle or horses do not become infected from goat parasites and basically act like vacuum cleaners cleaning up the infected larvae in the pasture. Some of the management practices we can use to reduce parasite problems include stocking rates of less than 2 head per acre. Yes, we can safely stock over 2 head per acre. We just have to realize we're going to have more parasite problems and just be aware of it. Grazing cattle or horses with goats, as we talked about, cattle or horses can vacuum up those infected larvae. Don't graze close to the ground. Most of our infected larvae are in the lower 3 inches of the grass. Haymaking or tillage. If you make hay and you roll those infected larvae up in a round bale, they only last about a month before they die. If we can till those infected larvae into the ground, such as by disking, they will die. A pasture rotation with 6 or more weeks of rest, depending on where you're at, is going to help to clean those pastures off, as those infected larvae die, especially in hotter weather. If we can get animals browsing or eating high off the ground, we're going to have a lot fewer parasite problems. Future prospects for parasite control. We're not likely to have new dewormers licensed for use with goats. There's a lot of research been done on vaccines for the past 20 years, but still there's no practical effective vaccine. There is a fungus available now called Dewormer that's approved, and we'll discuss it a little bit later. There's also paraprobiotic that we will discuss. There are specialized crops and copper oxide wire particles. Dewormer is a commercial source of fungus now approved. The spores develop to mature fungus in the feces. The fungus traps infected larvae in the feces by putting out loops for the larvae to wander through. The fungus digests the larva and uses it to produce more spores. This only kills infected larvae, or only kills larvae in the poop. It prevents the larva from infecting the goat in the future. It does not remove worms from the goat. It's a good way to prevent pasture infection. However, it must be fed every day, such as mixed in grain. Research in Georgia has shown it to be very effective in goats. The downside is it costs $60 to $70 to feed it for 6 or 7 months. We can talk about a paraprobiotic, Bacillus thuringiensis, which is a soil microbe, produces a protein called cry5b, which disrupts the gut of the invertebrate when they consume it, killing them. It's been used as a bioinsecticide for many years as Bt dust for worms that are on various garden crops. This organism had to be encapsulated in ghost cells to get it to bypass destruction in the rumen. It's very promising, but we're going to have to wait a little while for it to be approved by the government and commercialized. We can talk about specialized crops with tannins that have been shown to be effective against parasites. Not all tannins are effective against parasites, such as those in oaks. But some tannins are very effective against parasites, such as Sericea lespedeza, sandfoin, bird's foot trefoil, and chicory. So these crops can help us tremendously with parasite control. Another alternative control strategy is the use of copper oxide wire capsules. They seem to be most effective in young animals against the barber pole worm. The goat dose is 2 grams for less than a 50-pound animal and 4 grams for an animal over 50 pounds. Half that dose is used for sheep because of their sensitivity to copper. The capsules are available from various sources on the internet. Used only on animals that need to be dewormed, and it's only effective against the barber pole worm. It is possible to breed for resistance to worms. It's slow, having a similar heritability of about 0.3 as in sheep. There's research in Scotland that has shown progress over some years, 5 to 6 generations, at a similar rate of improvement as in sheep. However, the first year they made tremendous improvement in their flock due to getting rid of the 20 to 30% of the animals that produce 80% of the fecal eggs. There are differences in mature immunity between breeds, shown here for the hair sheep, but also for goats. Angors are the most susceptible. Boer goats are also quite susceptible. Spanish goats and Kiko goats have a similar degree of resistance to worms. Remember, there are resistant individuals in all breeds, and we need to select these to use to produce future generations that need much less deworming. In the near future, dewormer resistance will continue to have a major impact on the small ruminant industry. We're going to have to use more management and less dewormer. We're going to have to monitor for parasites, whether by FAMACHA or fecal egg count, and use selective treatment.